This is a podcast from the Nuffield Department of Medicine. Dr. Kerstin Luhn talks about her research on dengue infection.
Hello, Kerstin. What is dengue infection?
Dengue is, with about 100 million cases each year, a major public health problem in the tropical and subtropical areas of the world. It is caused by any of the 4 slightly different subtypes of the dengue virus, and the virus actually gets transmitted by mosquitoes. The severity of the disease can range from the relatively mild dengue fever with a high fever, debilitating muscle and joint pain and nausea, to the more severe forms like dengue hemorrhagic fever and dengue shock syndrome. Patients suffering from the more severe forms do, on top of the normal symptoms, develop quite severe edema or bleedings due to leaky blood vessels. Infants, children, as well as adults can be diagnosed with dengue, but it's quite striking that the most severe forms of the disease are mostly affecting children. And although dengue is such a big problem in the meantime, nearly half of the world's population is living at risk of infection. There's still no vaccine available, and we also don't have any antiviral drugs for treatment.
And what is the effect of dengue on our innate immune system?
The innate immune system is sort of a key component of our body's immune response. So it's the first line of defense, and it senses incoming pathogens and then sets the stage for all subsequent immune responses. So it has quite a great regulatory potential. It's very important in dengue because the virus is infecting innate immune cells and is replicating in them. On top of this, it's a bit of a special situation for dengue because there's a growing body of evidence that the immune system itself, rather than the virus, is causing the symptoms. So this phenomenon is called immunopathology. We are now trying to investigate how the virus is interacting with the innate immune cells. So we are looking at very, very early molecular events in innate immune cells upon dengue virus encounter. And our aim is to understand how and actually into which direction the virus is trying to push the immune response, so that patients with dengue actually or finally end up with immunopathology in contrast to patients with a lot of other viral infections.
And could this research lead to a vaccine or better treatment?
A lot of different factors are actually important or play a role in the outcome of dengue infection. For example, the genetic outfit of the host or the virulence of the infecting viral strain. But most notably, the immune response seems to be responsible. By stimulating the immune response in an inappropriate way using a vaccine, the outcome of a subsequent dengue infection could even be worse, so we have to be really careful with this. Therefore, basic understanding of immune processes in dengue are vital for the development of a vaccine or also for the identification of new drug targets. And our work has the potential to provide key information regarding these processes.
And what are the most important lines of research that have developed over the past 5 or 10 years?
It has been quite important to the field that finally dengue has been recognized as an important and re-emerging disease. So case numbers are dramatically on the rise. There have been suggestions that due to global warming, the geographical distribution of the mosquito might increase and hence the dengue prevalence. But these facts have broadly been acknowledged by now. In addition, the field has been hampered for a long time by the lack of suitable model systems, and some studies into this improved the situation enormously, now allowing research into diverse directions, and we are now able to address a much broader range of questions.
And how does your research fit into translational medicine within the department?
I think our work fits in quite well with work that is done by other groups in the department. So, for example, we are collaborating with Professors Cameron Simmons and Jeremy Farrar at the Oxford University Clinical Research Unit at Ho Chi Minh City, Vietnam. Through this collaboration, we have access to dengue patient samples that help us to confirm the results that we obtained in the laboratory. We can then use those results, they can be translated and actually be used for the design of potential new drugs or a vaccine.
Thank you, Kerstin.